It is 2021-07-01 at 01:59, and it is this is gum graft surgery update number 5. This is update number 5 for the maxillofacial surgery update number 5 for my gums. It's update number 5. Today I went to, or yesterday, by just a few hours, I went to my dentist, Dr. Emily Russo-Shank, and had my teeth cleaned by her hygienist, dental hygienist, Tara, and probably had the most thorough cleaning I've had in years, since high school probably. It wasn't that it was terrible before, but I had more time today, and stability, and they lent me more time than probably usually time would have permitted. And so this is a baseline video for my teeth, post cleaning, post me brushing my teeth, and doing as good of a job as I could on the same day within the same 18-hour time period. So I ate twice, 2 meals, 2 full meals, a lunch and dinner, and no breakfast, because that would have been before the cleaning. And today at the dentist, we decided on the bonding procedure and scheduled for it. And I will follow up post that with Dr. Sweidan for the surgeon, for Dr. Sweidan on July the 22nd. And July the next week or the week after, I'm going to be doing the bonding procedure. So it'll be like a rolling schedule. And we'll get the bonding on the tooth to reduce the nerve contact with surrounding air and stimulation of the nerve, and complications with my diagnosed epilepsy. It was diagnosed again in October of 2020, finally. It took a decade to pin it down officially, but it has been, in the exposed nerve for this was a significant problem. And now that the successful surgery of March of 2021-03-05 with Dr. Sweidan, that is going to be preserved by this bonding procedure with the tooth, in which it will be it was described as a fingernail on top of the tooth, and will reduce or eliminate the nerve contact for the future to preserve the integrity of the gum line and structure, since it is still fairly drastically receding. And as with the stage 4 malignant melanoma and the interferon, it seems to only be confirming what I was told years ago, to be considerate of this in case the immune response would cause issues with the plaque buildup. Not that it's anything else, but that it is still ongoing and has not been solved, even with multiple attempts to tackle this. But this is the first big push. And now I will show the actual teeth area, and the toothpaste in the private end, and the gum picks, to show what I have been using before today and what I will continue to be using post 2021-07-01. So again, this is the 5th. So this is the 5th 5 for the gum graft surgery 2021-03-05 update number 5. Done about 12-13 hours, 14-15 after my 2021-06-30 appointment with Dr. Emily Russo-Shank and her dental hygienist Tara to clean the teeth, and is responsible for this baseline. And I will now show the products that I'm using and will continue to use until the bonding is put on for this tooth here. This here is the toothpaste I use, the Aquafresh Extreme Clean. Aquafresh Extreme Clean, whitening action, fluoride toothpaste, microfoam activating action. This one's net weight 5.6 ounce, 158.7 grams. Trying to find the label. Here's its product code, I think. Oh wait, maybe it's right here. Yeah. For the expiration. And here's the active ingredient, the sodium fluoride, 0.15 fluoride ion, anti-cavity. This is one I've been using and was approved by MD Anderson. I've been using it, so it's been in use. This has been in use for effectively my whole life, I think since I was in early elementary school, probably. Maybe before I got cancer. Almost positive. If not, then right before. So it would have been 3rd grade. If at the absolute latest, but I'm almost positive it was before. And that would have been the Extreme Clean. Maybe not the microfoaming action part, but probably, maybe not the sugar action protection either, but it always looked like this. And it's always been what I've used, and it was approved for, even with the consideration to the degradation of the jaw structure from the loss of the gum line and connections because of the immunotherapy, the interferon for my stage 4 malignant melanoma. This was what I was supposed to be on, so I will continue to use it. This has been my regimen for neutral sodium fluoride solution for the dulling of the nerve and stimulation for the gum graft surgery area region for the exposed nerve ending to prevent interactions and complications with my already present brain and central nervous system damage from the interferon and cancer, potentially, but are only known to be the interferon. And this has been effective, but is not an efficient long-term solution, and it still does not take away at all any of the sensitivity, pull my lip pain, touch it pain, etc., even with the graft on. But that's to be expected with how severe my damage is. This is working admirably in the situation that it has been prescribed, from my understanding from my physicians. And that's Prevident 0.2 sol 473 milliliters. Use a I'm supposed to use twice a day. And it does last about the month. And here's the lot and expiration for this, prescribed by Dr. Emily Shank. And these are the gum picks that I'm still currently using. The green ones, not the blue, because the green are the specific type for the for my gum structure with its integrity. And these have been effective as much as I can be to remove plaque on all of my gums, and it builds up on all of the individual teeth in the gum line in general, as I am unable to fight it off properly. Again, this has been the 2021-0701 gum graft surgery update for the surgery that was performed on 2021-0305. This is the 5th status update video. It is currently 2021-0701 0223.